Yes, well, actually the practice did take off, and there was never a shortage of patients. And I thought, if this about 1965, I started to think, I've got this system worked out, and I've shown quite a few people in New Zealand what it's about. But I think the ability to clinically induce centralisation, take pain out of the leg and put it in the back, it's quite important. So I went to one of the local orthopaedic surgeons, John Saunders, and said, John, look, I can do this pretty regularly. In 70% of patients with leg pain, I can take it out and put it in the back. And I can usually do it in 4 or 5 days max. And if I can't, then they're probably better suited to some other treatment. And I said, would you be interested in doing a little study? He said, I said, I haven't got time for that. I wouldn't have time. Hard time keeping up with all the patients. So I wouldn't have time to do a study. And I asked another couple of orthopods, because I thought, physios do it, it's not going to go anywhere. You need a doctor to help get recognition. So I thought, I'll write a paper about correcting the lateral shift, which I did, and I put it in the medical journal in 1972, I think, and they accepted it. When I look at it now, it could have been a hell of a lot better. It was a disastrously written paper, but they accepted it. And another orthopaedic surgeon in Wellington read it, and he said, I'll send you 2 or 3 patients, and if you can fix those, he says, well, we'd better do some sort of study. I saw them and I fixed them, but he didn't take it any further. He didn't anyway. He was also too busy. And I thought, I'm never going to get this idea. I may as well forget it. We'll sell our house. I discussed it with Joy. I'll sell the house. We'll go and buy a few acres out on the coast and buy a little farmlet, and we'll go subsistence farming, and I'll come into town 2 or 3 times a week, and I'll start a little clinic out at Waikanai, and see a few patients and just get the wolf from the door. And to hell with all this stuff. We bought the little farmlet, we moved out, built the house, and one of the guys that I had shown how to correct the lateral shift, Ace Neem was his name, and Ace was a good physio, and he was invited to a conference on the Canary Islands, which I had been invited to also, but I knew it was going to be a political thing, and I didn't want to go. But Ace went, and at that conference he demonstrated the correction of the shift. And he said, this chap McKenzie in New Zealand has developed some good ideas about back pain. Most of us are using them to some extent. And shortly after that conference, I get an invitation to go to the States when I come and demonstrate. Wow, someone's interested. Couldn't believe my luck. Someone's interested. And so I went over to Rancho Los Amigos Rehabilitation Center in Los Angeles, where Professor Mooney was in charge. And the ladies, the physios who had invited me there, they organised this course. And it was a wonderful experience in so many ways, but it was also very depressing, because the first day, the first patient in fact, they asked me what sort of patients I wanted. I said, give me a difficult patient, give me people with sciatica and stuff. And we'll see what we can do with them. I can demonstrate whether they can be treated or whether they can't be treated. And so they did. They gave me their worst patients. And this first guy comes in and he said, I said, where's your pain? And he, back, the middle of my back, out to the right down my leg. How long have you had it? So I've had it about 10 years now. Constant or intermittent? Constant. By the constant, I mean, is it there every minute of the day? Or the times of the day when it stops? Every minute of the day. What treatments have you had? Oh, I've had quite a bit of surgery. What do you mean? He said, I've had 7 operations on my back. I couldn't find a movement that altered his pain at all. The second patient came in, he had 5 surgeries. The next patient had any, but he had something else wrong with him. And I began to regret having said, give me the worst patients you can find. Anyway, at the end of the first day, a lady came in. She hadn't had surgery, and she'd only had the symptoms about 3 months. And they centralised, just as the morning lecture. And I had no notes. I just talked about what happens when you do things to people. I didn't have any slides or notes or anything, no tapes. And I used to talk, and I say, if you move the pain to the middle, they get better. This is what you do. And here's this lady doing exactly what. Do this. What's happening? Going into the back. What's happening? It's getting less. And she got better. 1 patient out of the 12 I saw got better. Well, it was so, they were so impressed. Some of them went away to their clinics, and patients do exactly as they were supposed to do. They didn't have this chronic population, because Rancho Los Amigos was a rehabilitation centre where all the failures go. But some of these people went away to their clinics and they got the same results. So within a few months, I'd received letters from 3 other hospitals, would you come to our hospital? So I packed my bags and went off for a month. I went to these other hospitals, one in San Francisco, the same one in Rancho Los Amigos in Los Angeles, and I went over to a hospital in Pittsburgh. And of course, every time I thought the only way I can do this is to demonstrate for 4 days, because I reckon in 4 days I can show the progressions you need to make. If the patient hasn't responded the first day, then you make a progression, and if they haven't responded the second day, there's another progression. I reckon by the fourth day you can demonstrate all the progressions. You can also demonstrate that over 4 days people can make significant improvement. And every time I completed a course, 3 or 4 more people would come up and say, can you come to our hospital next year? Or can you come to our hospital next month? And at the end of 2 years, I had so many courses requested. I was booked up till, this was 1983, I was booked up till 1986. Then I came back and I said to Paula Van Wyman, who was my assistant at the time, I said, Paula and Mark Lazar and Ace, would you guys be interested in assisting me in coping with these courses? And yes, of course, they jumped at the chance, because it was paid well, and it was, in those days, I chose to charge $200 a day, which was, the Americans just laughed at it. It was just a joke. You should be getting $200 an hour for teaching all these people. Anyway, it was still quite good. I was quite happy to have remunerated $200 a day. And Paula and Mark and Ace would go over and they would do some of the courses. But, and this I will not go into any great depth, but it became clear that they were organising for themselves courses and not teaching necessarily what it was that I did. So by that time, several of the Americans had attended several of the courses. There was one guy, Ron Bybee, who was a naval officer, and he's sitting there in the audience in Rancho Los Amigos. And the same guy's there, stood out like a sore toe in his uniform. Same there 6 months later. And then in San Francisco he appeared at the course in San Francisco, and then he appeared in Pittsburgh, then he appeared in Cincinnati. And I says, Ron, you have been now five or six times to this Part A, Lumbar Spine. He said, yes. I says, am I not making myself clear the first time? He says, no. He says, every time you treat the patients, I learn something new. I said, right, okay. So I decided that I would get him to be involved as well. And then there was another 3 or 4, Dan Kelly, Kathy Hoyt, Ron Donaldson, an orthopedic surgeon. They became fascinated with this whole thing. It was completely foreign and anathema to the whole concept that they were working on in the States in the late 1970s and 80s. Because everything was flexion. You open the frame and release the nerve. So everyone was doing flexion exercise. Here's this mad guy from New Zealand comes down and says, you extend everybody, or you extend most people. There's a time, I used to say, there's a time to flex, there's a time to extend, there's a time to move sideways, laterally flex. But you've got to make an assessment of the patient to find out what causes the pain to move to the middle. It's very simple. The US physios who were assisting me said we should really formalise the teaching so that we're all teaching exactly the same stuff, and there's no injection of foreign ideas. Because they'd, on one course, after a course was given by one of the Kiwis, someone wrote into the organiser and complained that the lecturer had spent an hour talking about something completely different, which they knew wasn't McKenzie. They paid to hear what McKenzie was doing, not what this person was doing. And the Americans said, we've got to formalise this and make sure that everybody is getting taught the McKenzie principles. So they formed the McKenzie Institute. They asked me to be the president, which was obviously something I couldn't really escape from. And they formalised, they started to write it, record everything, and they said, by that time, this is about 3 or 4 years after I started, I had developed the key information on slides. And we formalised everything so that everything was taught, everyone had a copy of the same slides, we used the same written material. And so we grew, the institute grew, and then it was formed in Holland, and a branch was formed in Holland. I was, after the States, the word whooshed everywhere. And I got an invitation to go to Holland, invitation to go to Denmark, UK, Sweden, Norway, Canada. And Vert Mooney at Rancho was so impressed with the patients on the second course, said that this is something that needs to be known in the Spine Society. So Vert, in the meantime, he left Rancho Los Amigos and was the head of the orthopedic department, professor of orthopedics in Texas, at Dallas, Texas. So he set up a big conference and he invited a whole lot of orthopedic people, and he invited me to be among the speakers. And he went round, I found out later, that he'd gone around talking to all the physios. Do you use this McKenzie stuff? They said, do you use this McKenzie? Yes, wonderful, marvellous. Far better than Williams flexion exercise. The assessment process in itself is a delight to practice. So Vert had gone round asking all the physios what they thought of it. And he came up to me and he said, I've been checking up. He said, every physio I've talked to is using your system. He said, I think you should get an invitation to join the Spine Society. So in 1983, I get this letter from the Spine Society saying that I've been admitted as a member. I'd done no research. I'd just written the lumbar spine, and Vert had proposed that I be admitted on the strength of the book, The Lumbar Spine, the first edition. And when the first meeting of the Spine Society I went to, there was no one, very few had ever heard of McKenzie. They hadn't heard of McKenzie exercise. But over the next 2 or 3 years, each time I went to the Spine Society, someone would come up and say, oh, my physiotherapists are using your exercise. We're getting great results. And so it slowly spread through the Spine Society. And then the Danes started reporting research, and then there was research done in the States. The evidence now is every day, no, not every day, probably 2 or 3 times a week, there's a new paper comes out. And the body of evidence now is quite astounding. I mean, I can look back on it, and once upon a time I had nothing to quote. Now I've got all sorts of stuff. The latest ones were from Aberdeen, where they have been doing dynamic MRI, and they've found that the disc on bending forwards and on bending backwards and sitting correctly and sitting incorrectly, sitting slouched and sitting upright, the disc is moving exactly as the theory prescribes. It was published in Spine a couple of months ago. And so the evidence has mounted, and that was the title of our last conference in Queenstown in March of this last year. The evidence mounts. So the Institute has taken a leaping forward by leaps and bounds. There are now 30 branches in different countries. We've just agreed with the Chinese Ministry of Health, well, not just agreed, but 2 years ago we agreed with the Chinese Ministry of Health to teach rehabilitation physicians in China the McKenzie system. At the dinner, the chairman of the Beijing hospital, through an interpreter, said to me, Mr. McKenzie, will you be able to teach all our rehabilitation physicians? And I said, well, we'd be delighted to start the process. How many people are there involved in rehabilitation in China? About 650,000. And I said, this could take some time. So we've entered into a 5-year contract to teach their English-speaking physicians, which we're doing at the moment. In fact, Grant Watson is up there at the moment, I think. Well, no, he's in Japan. So we have 2 or 3 courses in China each year, and at any one time, at any time of the day or night, there are courses going on somewhere. So the Institute has flourished, and we can't really keep up with it. The demand for courses is increasing everywhere.